Many thanks for rejoining us on TMI on ITV Network, a special Easter Monday edition. We get our conversations on course as we look at the issue of health sector reforms, a review of the enabling laws. Of course, you know that in constitutional democracy, you really can do anything except there is a provision, there's an enabling law to give you the guidance, to give sanctions and what have you. And today on the program we have the member representing Eastern Northeast, Eastern Southeast Federal Constituency House of Representatives, Barrister Sergius Osasochi Ogun. Many thanks for joining us.
Thank you for having me. Good morning.
And happy Easter.
Yeah, we should say happy Easter.
Okay. The health sector has been a major talking point as far as I can remember. But we know that year in, year out, there are budgetary provisions. And it looks like most of those budgetary provisions don't get to the end users. In a sense, the institutions, whether at the primary level, secondary level, or tertiary level, where these funds are supposed to get to drive access to quality health care for the people of Nigeria. What's your take along those lines?
Yeah, I think government for a long time has been paying lip service to healthcare in this country. And that's why we are where we are today. There should be consequences for every action taken. But we have discovered that in the past, the government used to say, they just talk, but the chicken has come home to roost now. That is why there's panic in the land about our health care. I personally believe the most important of the three you just mentioned, the primary, the secondary, and the tertiary, is even the primary. Because most of our people live in the rural areas. Most of the primary healthcare centers are not properly managed. There are basically nothing. Then you have maybe midwives or nurses that are there that are not properly remunerated. I spoke with our brother, who is the Minister of Health, Dr. Hanuri, some time back, because I wanted to do something about the primary healthcare centers in my constituency. And he said to me, as laudable as most of these things you are suggesting are, the most important thing in the primary healthcare center is water. And from my own part of this state, the water bed is very far. So I did for about 3 in each local government. I represent 2 local governments. Sank borehole in them and then brought in solar lights because women are giving birth in the night, there's no light. You are using lantern or in other cases, torchlight. I mean, we are in the 21st century. Yeah. Where does that still happen? So I think largely because government just paid lip service to this and nothing was done about it, now we are panicking because the doctors we have are all going out. There's nothing to practice here, besides the fact that they are not properly compensated. People go to school for, well, if you add the ASU strike to it, most times for 10 years before they graduate. And then they take home little or nothing. There is a lady that told me she spent 10 years to qualify as a medical doctor here. And then she's practicing with a young girl that went to Sudan to study medicine, Sudan, and she spent 5 years. So due to no fault of hers. So if we can get the government to provide enough money to the healthcare sector, that will help a great deal in keeping our doctors active here and allow them to come alive in their practice. And then having the necessary tools to work with. And then also the fact that, where we say we are the giant of Africa, countries around us, our neighbors, should actually be coming here for their health care. That should have been maybe reverse medical tourism, and not we are going out. They should have been the ones coming in here and will earn huge revenue from it. Because at times when government says tourism, they're just paying lip service to it. This should have been a huge industry because of our size and the human resources that we have.
I recall some time ago you were at the forefront in driving this issue of stoppage of medical tourism, as it were. Then all of a sudden you're also advocating for us to look at how we can reduce the menace of the mass exodus. I'm using mass and exodus now for emphasis of our medical doctors, to foreign land. How realistic is this? How realistic is this? I mean, in terms of the possibilities of achieving this. Recall that your efforts, for example, to reduce medical tourism didn't quite get the required support needed at the time. So let's get your take on this.
Yes, well, in the 8th Assembly, I brought a bill to stop public servants from going outside for treatment. Well, the bill did not fail, but was technically managed in a way that it didn't pass. How? We had first reading. It took almost 2 years for it to be slated for second reading. That is not the speaker or anybody. It's just the civil servants. I also didn't want it to come alive. Then after taking it, to even do public hearing was an issue. So we had to discharge the committee of the responsibility of taking it because they had not submitted a report. And then it was to be programmed for for committee of the whole, clause by clause consideration. It will be on the other paper, then it will be removed. So you never saw the...
So was this politics at play?
Oh, yes. So till the expiration of that 8th Assembly.
Now, considering the rate at which medical doctors operate their private hospitals, do you think it will be possible to have a holistic reform in our health sector?
No, but I would have loved to land this one.
Okay.
Yeah. So when in this 9th Assembly, I felt, okay, fine, since there were too many forces against that bill, let me even amend the act, because there's an existing act, section 46 of the Health Act 2014, says that you cannot go, a public servant cannot go out for treatment overseas.
Okay.
But if you must go because there's a terminal illness that cannot be treated here, there should be a referral board that will examine and scrutinize this and then give a recommendation to the minister in the federal or in the case of the state commissioner of health before you can get that approval to go. That is the law as it stands today, section 46 of the Health Act.
That's the law, is in existence.
Yes. But who is listening? Who is following this law? So what I'm saying, okay, now that law, there's a lacuna. The law doesn't have any sanction. So if the president, as he's been doing, goes out to check ear infection, we don't know whether there was a board that went through it to examine if it's something that cannot be treated here. The president was out of this country for so many months, once upon a time. And we didn't even know what the ailment was. So which means nobody's even bothered about that law. So because there's no sanction in the law. So I felt, okay, fine, to restrain public servants from doing this, there should be a penalty. So that was the amendment I brought in this 9th Assembly, that if you flout this law, you will pay 500 million.
500 million.
Yeah, I will tell you why. I will tell you why. Or you go to jail for 7 years, or both, Though most of my colleagues challenged that, to say it's too heavy, but Nuhu Rubadu, the former EFCC chairman, talked about, I think it was a Punch publication some years back, about the former governor of Bayelsa State, how that he took so much of the state funds out. He just give an example of one governor. Most of them are doing it. Took so much of the state funds out under the guise of medical treatment. And the guy had 4 houses in the UK, I think about 10 in the UAE, and then he was caught with £1 million, and he had about £2 million in another account. These are monies belonging to the states under the guise of medical treatment. But yet, if we had followed that law, none of this would have happened. So that's the point I was trying to make. That so if you flout that law, this is how much you pay. So if somebody has taken out billions, how much is 500 million? That's a fine. Coupled with the fact that that person can go to jail.
This law, in the effort that you're making, you know, in reforming this law, is targeting the elites. Yes. They always have a way of fighting back. How do you what's the possibility of this amendment that you're proposing seeing the light of the day against the background of the experience that you had with the issue of medical tourism?
Yeah, well, now, as you know, we are rounding up, and by June, less than 2 months away now, we'll come to the end of this next assembly.
Yes.
I have written to the chairman of Health Services for public hearing. Nothing is happening. I have written to the chairman of Rules and Business to say, okay, we should discharge this committee because they have not met the time allowed for this. I still haven't gotten any response. In short, 2 letters to the chairman of Rules and Business to say discharge them so that we can do clause by clause consideration and then do third reading. Nothing is happening. So most likely it's going to end up the same way the other one ended up. But it's fine. Like I've always said, it doesn't have to pass. But a day will come in this country, and we're almost there, when you will have a government that will say, if you are a public servant, you can't even go out for treatments. You have to use the institutions we have here. That day is very close. That day is very close. So they have a window now to do the right thing, to say, okay, if you do this, you will pay this penalty. We are foot dragging. But a day will come, like I said, very soon, when the window will not even be there. So there will be somebody that is not well, maybe a terminal illness that cannot be attended to here, but the law says you have to be treated here.
Okay, now seeking greener pasture is something we cannot do away with as far as the country is concerned. And our best hands are exiting the country and going elsewhere to practice. Do you think there are things that can be put in place to ensure they remain here?
One of the reasons I gave for the first amendment in the 8th Assembly was the export of our medical doctors.
Okay.
The reason one of the reasons I gave again in the amendment in this 9th Assembly is the same thing, because they do not have facilities to work here. Then they are not properly remunerated or compensated for what they do. Like I said, why will you go to university and spend 10 years, okay, even without the ASU strike, 7 years is a lot of time to spend in university. And you come out and you earn little or nothing, and you have nothing to practice with. And knowing that if you cross these borders and go to another country, you will be well taken care of.
It's greener there.
It's much, much greener. So why will you stay here? And now that's why we are panicking. My colleague brought a bill last week, Thursday, saying that for those graduating, for medical doctors, should not be allowed to japa, leave the country. Yeah. They should not be issued a license till 5 years after practice in Nigeria. Some people supported this. Others talked about human rights. But this is the situation here. How many people really want to leave their country if it's working well here? Yeah. How many Americans do we have working here or in other parts of the world? Yeah, some travel just for, just want to go out of their country. So if we have the necessary facilities here and they earn good salaries, they would like to stay here.
Okay.
So the thing, my advice to government is, that's why we are saying, let's stop medical tourism. So if we are all going to stay here, either we drown or we swim out of the situation. We will give attention to it. So earlier you said it's the elite. Not necessarily the elite. If you're in private practice, of course you earn your money. If you're a businessman, you earn your money. Nobody's saying that you shouldn't travel. Yeah. As long as you are earning your money legitimately and paying tax.
Adequately.
Yes, but if you are a public servant, you make the law. You execute the, law, the budget. The public servant, the civil servant, prepare the budget. The legislators approve the budget. The president or the governor signs the budget. And then the budget goes back to the
civil servant.
The civil servants to execute. And then if these people, this class of people are traveling out when they have ear infection, what's going to happen to the common man that they are supposed to be serving? So till we say, you cannot go out, we're all going to stay here, they will not give attention to the health sector. just like it's happening in the education sector. So if they have to go out to attend to their children when they are not well, they themselves, if somebody is not feeling well, he hops on the plane and is out. Look at the cash flights. And then you see governors talking about state-of-the-art hospitals in their states, and yet they do not patronize them. You know, it's lip service they have been paying, but we are saying enough is enough. Let's begin to look inward. If the governor cannot use the tertiary institution, tertiary institution in the state, he cannot go out. Same with the man in the rural area. You should be able to walk into a primary healthcare center and get advice. Many people are dying for a needless illness. Most people in the rural areas, they have high blood pressure and high sugar. What's responsible for that? Because of what they eat. A simple dietary advice would have taken care of that. Yeah. But they don't know. Somebody says, somebody has high sugar, is eating pounded yam, taking alcohol. He doesn't know. You know, but how much will it cost to have somebody, a medical doctor in every political ward where you have more than one primary healthcare center with an ambulance? Little or nothing. So I think we have neglected not just the rural people, the so-called underprivileged people in this country for too long. And that's why the agitations are coming up. But when I hear some of our elites, you know, when I hear some of their commentaries, I begin to wonder, I think they've lost touch with the people. So some of the things they are saying, they've lost touch completely with the people. If you just allow a little to trickle down to the people, whether it is healthcare, whether it's education, whether it's basic infrastructure, you will not have most of these agitations. But in a situation where they have been cut off from the system, you will expect this.
Will adequate funding address some of these issues that you've highlighted, particularly at the rural level in terms of provision of health?
Well, yeah, adequate funding can be in two folds. You can throw the money at the problem without really diagnosing what the problem is. Like I just talked about the primary healthcare centers now. Most of them do not have lights. What is wrong in having solar system there? What is wrong in having accommodation for a medical doctor? Now we're even saying that they shouldn't travel or they shouldn't be given a license after practicing here for like 5 years. We can even send them to the rural areas with proper accommodation and with an ambulance that allows you to move around at least for the young doctors. It's okay, you must practice in a rural area for 5 years before you practice in the city. That can be part of solving the problem. Okay. So if you have accommodation in every rural area for such people and you have an ambulance to enable them move, that's not the primary purpose of ambulance. Anyway, there's funding there. Yeah. But you also have to supervise to make sure that what you have put the money in there for is fully utilized. Then what about the equipment? What will it take to have the basic equipment? Like I said, have solar lights in a facility like that. Yeah. When women are giving birth, they should be using lantern or torchlights. You know, the place should be properly secured. There should be a borehole, there should be water.
It looks like the rural areas, from some of the analysis that you have given, they are just at the precipice in terms of being disadvantaged. I've also heard people talk about the NCC Act that provides some level of access to telecommunication and all of that, with funding to deploy this facility, because it's really heartbreaking that you get to certain communities at this time and age, no network service. What is the position of the law in that regard? Okay, thank you. Now we just talked about even the health sector, and we've heard a lot of the governors and government talking about telemedicine. So if we have the rural people in mind, they should have full coverage. There should be network for them to do that. So should report situations there, even if the doctors are in the US, should be able to collect the information and also respond. So which means you can actually have a local doctor do a surgery with guidance from a medical doctor in America or in Canada or anywhere. Okay, folks, now you have the NCC Act, or National Communication Act, that gives power to NCC to regulate basically the industry and to design a framework for the industry. And that act also allows NCC to collect 2.5
1% of the annual turnover, which is the renewal license fee of the telcos,
Okay.
the telecommunication companies.
Okay.
And that money, 40% of it, NCC has allocated to universal service provision. The biggest question that we should be asking, earlier I talked about consequence management. The biggest question the question we should be asking, how is that fund being utilized? Because if we are properly utilized, and we're talking about millions of dollars. If that fund is properly utilized, we will have universal coverage. Now, we just came through an election where they were telling you about no network.
On beavers.
But there's money allocated for this. And the first assignment the NCC embarked on with that fund was the Emergency Response Center, EROS. Most of them are not working.
Were they stationed at districts or local government areas?
It's all over the country, states and some rural areas. Because the essence is, you should be able to call an emergency number if you are in distress.
In any part of the country?
Yes. Over the weekend, on Saturday, yes, on Friday or Saturday, Friday, I was in the fire station in Obiaja. I went to give them a generator because they said they don't have light, they need to pump water. And then we extended the hydrant where they will get water for the truck. And I just saw the emergency number, 112. And I called the number. And I was told I was number 30 on the queue. So if there's fire, I'm going to be number 30.
Waiting for a response.
Yeah, exactly. So I cannot even tell you where the fire is, what kind of fire it is. So the emergency response centers, supposedly that these monies were invested in, are not even working. And then, during you remember we had the crisis, that was the last time I was here, we discussed about the CBN and the inability for people to get money.
In cash crisis.
Yeah, how you're going cashless then. The CBN governor had told us that they have over 30,000 mobile money agents in the rural areas. So this was supposed to transact at least with some basic network that they cannot get. But funds being provided for this. Then there are businesses. I could have been in my village this morning transacting. Because we have been told to go back to the rural areas, go and do business. Because that's the only way we can actually prevent what is staring us at the face right now. If you have industries in the rural areas, we can farm, we can have produce, but the full value chain, that's where you really employ people. When you begin to process in the communities, you engage people, you stop the urban drift. People stay in their rural, in their community, develop, earn money, they build houses and,
live their normal life.
Exactly, but you also need basic things like light and like telephone to operate there. So if the law has provided for this to happen, the agency responsible for this is sitting there and not doing anything about it, how is it going to happen?
Is the National Assembly failing in its oversight functions in dealing with agencies of this nature?
Unfortunately, yes. I just brought a motion on this now, and the request is let it go to an ad hoc committee, maybe the standing committee. Maybe they are saddled with too much responsibilities not to look at this, because this has been happening. So the way to speedily look at it and do a surgical operation is to get a small committee to aggressively go at it and let us know why they are not effective. Because it's affecting everybody. These are basic things that should have been done.
805.
So that is our request. The National Assembly should speedily get NCC to address these issues.
Okay, quickly. It seems private practice is a norm with government employees, like medical doctors who are employed in government sectors, health sectors. They end up having their private hospitals outside. Do you think it's going to pose danger to this reform that we're talking about?
I don't think so. Because I think, again, you see, people talk about corruption in the private sector. It's not a problem at all.
Okay.
Because you always look at the bottom line. If I have a company and the company is not doing well, I'm going to look at it and maybe sack people. But in government, it's not like that. There's a benchmark. Every 5 years or every 10 years, you're supposed to get promotion and people get promoted.
So you can still be on government payroll as a medical doctor and operate a private clinic.
Yeah, that's what I'm saying. That is not the problem at all. If anything, that adds to the experience. So if you are supposed to give me as a government 8 hours and you come to work and give me that 8 hours, I shouldn't be concerned with what you're going to do with whatever number of hours that's left. Even in the Western world, most of our relatives that are in the Western world, ask them the way they work. Most of them, they have 8 hours, some 6 hours. But after that, there must be a second and a third job to enable them pay their bills. I know most of them are retired. They get pension, but they still work to support their pension. So having a private practice is not the problem.
Okay.
It's just government monitoring what they are doing when they should be doing it.
You've emphasized one thing, that a lot is happening in the country reflective of the trends. We just came out of a very interesting election, and in the post-election discussion, we've had issues of ethnicity, tribalism taking the front burner. What would you say is your major pullout from the election, particularly against the background of some of the conversations that have dominated the national space?
Yeah, I think our failure to speak to the issues. I watched the program yesterday evening, and there was one elder, very senior man from this part of the country, who was talking about this is the last election has been the freest and the best, that the young people really haven't experienced some elections in this country. If you ask me, with due respect to him, it's like speaking from both sides of the mouth. We had an INEC chairman who told us that we're going to have free, fair, and credible election. Of course, that is expected of him. And he told us the mode of how they are going to transmit the results. Then the election came. I mean, you did not only tell us here, you went to Chatham House and told the whole world. The election came, that was not fully adhered to. So that's all we should be questioning. Why did we transmit a part of the result and we did not transmit the others? Now we should be asking that. But to say it's fair, and then the same, the elders are our pride. But when they don't say the right things, they are misleading the young people. So that's why we don't have role models. When we talk about the young people who are not behaving well, they are down, they are not listening, who are their role models? When an elder lies to you today, tomorrow if you say something, there is every tendency that you don't want to listen to such a person. So the things that happen there, we should be, as we x-ray them, we interrogate those things. The INEC chairman should let us know clearly why he could not transmit the presidential result. We were the same, the House of Rep, the Senate were transmitted from the polling units. But 3 elections happened same day.
Yeah, same time.
Same time. You transmitted 2. I didn't transmit the 3rd one.
The big question.
So that's a big question.
So what's your take on the insinuations in some quarters of an interim government and all of those talk? I mean, that has been in this political space for a while now.
Well, unfortunately, there might be an interim government. Unfortunately, it's not something I support. I mean, you cannot be a Democrat, you say you are supporting it. But the players are working towards it happening. The same people that are saying it must not happen, it should not happen. Okay, now we have an issue. The elder that I spoke about, who is a very senior lawyer in this country, I expect now they will be appealing to the judiciary to do the right thing. You don't tell a man go to court when you know he's not likely to get justice. If we are sure that we had an election in Kenya, we saw what happened. There was one that was cancelled, presidential. Uhuru Kenyatta. Then there was a rerun and he won again. Then when he was finishing his term, there was another one. They went to court. In a matter of days, the judgment came and the man was sworn in. So why can't we have that here? So when you tell a man go to court, you have taken care of that already. So what's going to happen to the man? When the man knows he's not going to get justice, they'll resort to self-help. That's what we are going to. So now, you have said go to court. The people don't know what to get from the courts. With the judgments that have come out from the courts lately, people are not sure what they will get. Now, they begin to dip their fingers in the parties. The PDP have crisis right now. You can say that one is self-imposed or self-inflicted. What about the Labour Party? We believe there are external forces right now trying to wreck that party. So, where post-mortem now, what are they doing? They are basically instigating other people to come in and rescue. Because you are saying go to court because you believe they will not get judgment. Then, while they are in court, you are beginning to instigate crisis in the political parties. These are all working together for an interim government. Because a day will come, there will be crisis everywhere, and they will say, okay, fine, you guys step aside. Let's try and manage the process for a while before we bring you back.
All right, May 29 is around the corner. What should Nigerians look out for in the government of the president-elect?
Yes, on a final note.
On a final note.
Oh, well. I don't know whether I want to speak about the president-elect because there's a case in court. Yeah, but in any case, well, that will be May 29th, and hopefully there will be change in government. And we hope whoever emerges would know where we are today as a country and address the people. Because the people, they are the most important component of democracy.
Absolutely.
So a situation where the elite stay there and plan for themselves cannot continue.
All right. Thank you very much, Barrister Sergius Osasijo Ogun, a member House of Representative, for creating time to be here today and give us some insight into some of these very salient issues. I hope when next we'll call on you, you'll oblige us.
Sure, why not?